everyone. My name is Ilya. I come from Russia, and I have been living in South Korea for 17 years now.
I'm Joseph from the States, and I've been here for the last 6 years. I'm really loving it.
Hi everyone, I'm Tambo from Australia, and today we have a very exciting event lined up for you. Normally we do these events in Korean, but just for you, we're going to be speaking in English exclusively. Yes.
Absolutely yes.
Of course. So Korea's done this great policy because the people who are most likely to have it are people coming from other countries, right? If you've been in a different country, when I came back, if you've been in a different country in the last 2 weeks, everyone could be tested for free. So it turned out it was okay, and it was really, really impressive.
What about you?
I was just an unfortunate victim of circumstances the first time around, but by the second time I had my identification card, so I think that was part of why I was able to get the treatment for free, which is great.
A runny nose, a tiny bit of a sore throat, occasional headaches. So I called the national hotline for disease control, and they said, you got to go to the hospital.
All of the entrances to Ide 서울병원 have been closed because of COVID-19.
어느 나라에서 오셨어요? 어디요? 뭐가 제일 불편하세요? 코 안쪽에서. 목 안에서도 같은 검사를 할 거예요.
발해가 있으셔서 환자분들 없는 곳에서 발해 요청 발해 검사도 그 코로나 검사의 한 가지거든요.
Guys, I want to give you a big warning. If you're a foreigner, it comes out to be like 520,000 won. That's like $500 US.
Why is it 50만 원? They're like 외국인이고요. 국민 건강보험.
Because you don't have the
Korean national insurance.
Yeah, national.
I was really lucky because I had 1 week left on my travel insurance. Bless up everybody, get travel insurance. Don't ever go without it. So that was 50만 원 out of pocket, but it got reimbursed. Then the second time was a bit more fortunate. It was completely free.
In South Korean system, we have covered the whole population, right? Like everyone has medical insurance, everyone is covered, and pretty much everything is covered under that health insurance plan. I have a lot of my friends, Russian friends, who are living in the United States right now, and I hear these horror stories about how they go to emergency rooms, for example, and wait for like hours and hours there just to get treatment, while they can be actually like physically bleeding. And that's something unimaginable here in South Korea. You can get the CT or MRI the same day you go to the doctor and get all the these 검사, right? Like all the procedures you need to do in the same day.
Yeah.
That's just fantastic.
Even my mom said, she said, if you're going to be sick in Korea. Don't come back to America and get sick. It's too expensive.
There was one time I even screwed up my back while doing a deadlift. I was like, 아이고, 허리 아파. And then I went to 한의원, get the whole testing, everything done. And
한의원
is beautiful. Like, yeah, come on, baby.
저는 이틀 전에 데드리프트 하고 있었는데 뛰는 이렇게 다쳤어요. 그래서 이렇게 똑바로 설 수가 없어요. 오 마이 갓.
침이나 물리치료 해야겠습니다.
바지 오늘 처음 오셔가지고 18,000원 정도 나왔을 겁니다.
네, 처음 오신 거예요.
I've always been impressed with the Korean healthcare system. Their 의료 제도 has been really good. The reason I've known this is because when I was here in 2016, I actually had what you call a 기흉, or a pneumothorax, to use a technical term. It's where your lung collapses and just explodes.
Did you go to the hospital?
But when I was in the hospital in America for 1 week, it cost me $10,000 US. So like 1,000만 원? Yeah.
Wow.
With insurance. But then I had it in Korea and with the national healthcare system for 2 weeks, so twice the time it only cost me like 230만 원인가? Since then, I've known that the Korean public healthcare system will do a good job, and Corona has just proved it again. Korean healthcare system has done just a beyond incredible job of making sure that every person has an opportunity to get treated and every person's going to be taken care of. I've been really, really impressed.
So being the loving son that I am, I frequently or infrequently call my mom through video chat and she's like, how's everything in Korea? I'm like, no, how's everything in Australia? You guys had the lockdown. Right. You guys had the sold out toilet paper and rice and pasta. You literally couldn't find food to eat in Australia or...
A lot of my Australian friends are asking me for photos of toilet paper, rice, and pasta here in Korea, because Australia seems to have run out of these very essential supplies. So today we're going to be going to E-Mart, check out what the stocks are there, and see how we're surviving.
Loaded with pasta, completely stacked with water. Absolutely no shortage on ramen. Here we've got plenty of instant rice.
How was it for Russia and America in terms of the lockdown?
We did have a lockdown in Russia as well. That was a huge one in Moscow during the peak of the pandemic in Russia, which was in April. There was a stay-at-home orders. You couldn't. It was even. They went even further. Like in order to leave your home, you need to get the QR code on your smartphone. You're allowed to only leave your home twice a week. You need to get, you need to go to internet, to the municipality website and apply for that QR code. And with only that, you could, go outside.
In Korea, everyone's still going out. We're wearing masks on completely packed subways. We're going drinking and eating, and life is almost as normal, but for some reason it just hasn't blown up. I think the mask is such an important part of that puzzle.
Yeah, I think that's something that's made me feel really safe. That's why I feel safe in Korea, is because I look around people, and people are taking it seriously, more seriously than in America and other places. So whenever I'm here, my friends keep asking me, aren't you worried, aren't you worried? And I say no, because I think people here have at least understood the seriousness of the issue and that it can become worse.
It's actually interesting you mentioned about wearing a mask. Probably the same problem with Russia right now. People just don't care enough of wearing masks. They don't believe that masks actually work.
러시아에 있는 친구들에게 전화를 해서 러시아에서 느껴지는 코로나 사태 물어보겠습니다.
Для нас, если честно, конечно, для русских наших, для нашего менталитета это абсолютно новая такая вещь, ношение масок, но, знаешь, я бы сказала 50/50. Кто-то вообще просто ходит везде, и с детьми, и ни у кого масок не нужна, я тут...
Went to the streets, they didn't wear masks, because everyone is like, well, it's a flu. What flu can do, And that's a stunning comparison with what we are seeing here in Korea.
The Korean government developed an assistance system for epidemiological investigation.
To run safety and prevent the COVID-19 in preemptive manner, the Ministry of Education postponed.
Government did a lot of job in conveying this information to the people. Pretty much everyone uses masks and sanitize their hands. There was a huge social distancing campaign as well. You can see all the banners in all the parks and along Hangang River as well.
Even when I go to McDonald's or Starbucks, there's the lines.
One thing that's fascinating to me in my previous lives, hand sanitizer was something that only very select people had, and you'd kind of see them as hygiene freaks. But overnight in Korea, it popped up everywhere. You'd see it on buses, trains, cafes, food places with 30 years of history that have no business doing something innovative. You just see hand sanitizer everywhere. What's been your experience with it?
So convenient, right? Yeah. Wherever I go, it's not like I have to, I need to sanitize my hands, I need to find it. It's always in front of me. I almost do it just because it's there. It's almost just like I open my phone, hand sanitizer, just done. And they made it so easy. When I was in America, I couldn't find it at all.
I mean, even if you go to the public places like parks, you can see all those hand sanitizers attached to the trees. And it's really, and people actually using them, because I see that people actually walk to them and they sanitize their hands. In Russia, it's unimaginable, stuff like that. If I put a sanitizer, if I attach it to the tree, it probably will last for 10 minutes.
Someone would steal it.
Yeah.
Oh my goodness.
Someone would steal it and use it at his home. But in Korea, the social responsibility, people know that it actually for their best.
What have you guys noticed has been unique about Korea's response to the coronavirus?
Probably one of the biggest issues on the news were the drive-thru, because that was the very first time that any country in the world implemented that kind of way of testing. And I actually saw them with my own eyes. Like, I didn't go through, I didn't get tested by like that, but I saw those stations when the car actually enters and those guys with the masks and stuff, in the suits, they do the testing. It looked like you are in a SF movie or something.
That's kind of the first thing in America that even Trump and others started talking about when they started talking about what should we do. Because now Trump's like, oh my gosh, it's actually an issue. They brought up drive-thrus. I remember watching actually the report and seeing the head of the CDC and other doctors in America saying, Korean drive-thrus are the way to go. So how can we take the Korean drive-thru idea and apply it to America? So what they did is they worked with business leaders and said Walmarts and other places to make them those drive-thru centers. So it was really interesting to see how America took a Korean idea and turned it into a way that would help America.
They do it in Russia as well.
Oh, really?
Yeah, that proved to be very, very effective because you can test a lot of people at the same time, and the natural environment of you being in your car and person being in the suit that helps to prevent the spread of the coronavirus. Yeah, that was probably one of the biggest issues and one of the most prominent ones that put Korea on the spot. We are still during the very heat of this pandemic, and virus has not been demolished completely. It's still around us. And that's exactly why an international news agencies got so much attention towards South Korea, because it's been doing so well. But still right now we're in the 50s, at the very bottom of the ranking, because there are much more countries up in the ranking than us. And probably there are a lot of reasons for that then being cited, like the total openness and information disclosure from the government, because government has been honest about what's happening. Like there is this lady, Chung Eun-kyung, 본부장님, she literally did the briefings every day, and she was talking about how much and what exactly are they doing, what exactly the situation.
코로나 바이러스 감염증 19 국내 발생 현황을 말씀드리겠습니다. 4월 6일 0시 현재, 4월 24일 현재, 6월 24일, 7월 3일 현재 지역사회 감염은 52명, 해외 유입 감염은 20명의 총 누적 확진자 수는 1284명으로.
So that was quite amazing, and I guess the whole transparency and the full information disclosure from the Korean government was very important, played a really important part in containing the whole situation with the coronavirus.
Korea, it can be done, but every person can do the little things to take care of it. Please wear a mask when you go outside. Wash your hands. Do all the little things that you can do. This is not only overcomable, but it's something we need to overcome together. It'll happen.
To all the people out there, I would like to say that look at the best examples from the first wave we got the coronavirus. We need to do that in order to prevent that, and even if there will be a second wave, fall or winter time, still, if we just keep our social distance and wash our hands, as ridiculous as it sounds, it actually helps. So I hope there will be no second wave.
I want to give a special message to my friends down in the southern hemisphere. Winter's about to finish. You're going to be going into great weather, and summer's coming as well. Please stay at home. It's not worth it. Summer is going to come again, and you can always get a tan next year.